Today is another big day for our healthcare workers in the fight against COVID-19. The numbers are continuing to trend in the wrong direction. Hospitalizations have set records. More than 12,000 Texans are in hospitals now with COVID-19 infections. Chris Sadeghi joins us live in Dallas outside of Methodist Dallas Medical Center as frontline workers are getting ready for another dose of the vaccine this morning. Chris.
Yes, Mark, that's because today marks 3 weeks since those first workers got their shots of the Pfizer vaccine. So now it is time for their second dose. They'll start getting that at 7 o'clock this morning here at Methodist. Meanwhile, the phase 1B portion of the vaccine rollout continues to be plagued with questions. We've heard from a lot of people who said that they've called around to hospitals, pharmacies, clinics, trying to schedule a shot and cannot get a good answer on how to get one. There's a couple of factors happening here. One is a problem with distribution. Hospitals were told to start vaccinating phase 1B, that's people 65 and older or those with chronic medical conditions, but the hospitals say they don't have the vaccines to do it. Secondly, some counties like Dallas and Tarrant Health Departments set up websites to register for people for shots. Those sites are already getting a lot of traffic. The state of Texas, though, is supposed to have a website of their own, a database of sorts showing us which hospitals in our area had them available. That website not ready until the middle of January. Dallas County Judge Clay Jenkins said that hospitals are left in a tough spot.
The state that was supposed to be doing the website for everyone didn't have the website ready. And it led to the hospitals and the counties having to get together and scramble and saying, okay, what do we do now?
So now that website is not ready until it is up and running, the state's just recommending calling around to hospitals and clinics, seeing if they have vaccines, although we're hearing from clinics saying they're getting overwhelmed with those phone calls. Once the process gets ironed out, the plan is to prioritize which patients get the shots based on vulnerability, those that have the more serious medical conditions. Kara, back to you.